Good evening, everybody, and welcome to this meeting of the Health and Adult Social Care Overview and Scrutiny Committee. My name is Councillor Patrick Canavan, and I will be chairing the meeting this evening. I'm going to start by doing something I don't normally do, but because we've got so many people in the room, I thought it might be helpful just to go around the room and do some introductions. So I've introduced myself.
I'm Sinead O'Callaghan. I'm the clerk to the committee today.
Hello, I'm Councillor Richard Burton. I've got the Children and Young People Education and Skills portfolio.
Hello, I'm Councillor Sharon Carr-Brown. I'm actually standing in for a colleague, Anne-Marie Moriarty today.
Councillor Rich Harrott, portfolio holder for Destination Leisure Commercial Operations.
Evening everyone, I'm Amina Martin, Director of Investment Development. I'm here for the Get Britain Working Cabinet Report, which sits in my directorate.
Councillor David Brown, I'm portfolio holder for Health and Wellbeing. I'm here for the duration.
I'm Councillor Chris Matthews. I'm a member of the committee this evening.
Councillor Dwayne Farr, member of the committee from Kensal Ward. Thank you.
Hello, I'm Rosie Napper. I'm here from Dorset Chamber. I'm here for the first item about the Get Dorset BCP working. Thank you.
Hello, I'm Sarah Rice. I'm the Head of Service for Skills and Learning, Adult Community Education, the Shared Adult Learning Service for BCP Council and Dorset Council, and I'm here for the Get Dorset and BCP Working and Connect Work piece. Thank you.
Hello, Tim Branson, Adult Social Care, Field Lives Transformation Lead.
Good evening, Siobhan Han, Head of Strategic Commissioning for Disabilities and Adult Social Care.
Good evening, I'm Zena Dighton, Interim Director of Commissioning for Adult Social Care. Thank you.
Yvette Pearson, Interim Head of Service for Strategic Commissioning Long-Term Conditions.
Good evening, Marianne Wanstall, Chief Executive of Tricuro, and I'm here this evening to share an update on Tricuro's strategic plan.
I'm Emma Senior. I'm the Commissioning Manager for Prevention and Wellbeing, and I'm here for the Adult Social Care Prevention Strategy.
Hi, I'm Betty Gutfeldman, Director of Adult Social Care.
I'm Councillor Hazel, I'm a member of the committee.
Councillor Lisa Northover, Vice Chair.
Thank you very much, everyone. I'm going to start the formal meeting now by asking the Democratic Services Officer if she would read out the housekeeping notice, please.
Thank you, Chair. Please note that this meeting is being recorded by the Council for live broadcast and will be published on the Council's website for a minimum of 6 months. The meeting may also be recorded or streamed for live or subsequent broadcast by members of the public, although ultimate discretion in this matter lies with the Chair in case of disruption. For those in the room, please note that if the fire alarm sounds, please exit the building by way of your nearest available signed fire exit route and make your way to the assembly point in front of the car park of this building. Finally, please ensure background noise is kept to a minimum and mobile phones and other devices are switched off or switched to silent for the duration of the meeting. For those in the room, this includes turning off microphones and turning the volume completely down on your laptops. Thank you.
Thank you very much indeed. I'm going to just ask Amy if you'd like to introduce herself. She's online, but perhaps by way of introduction, Amy, you wouldn't mind just saying who you are, please.
Yes, of course, Councillor. Yes, my name's Amy Walton and I'm here today representing the Get Dorset and BCP working plan, and I'm from Economic Development. Thank you.
No, thank you very much. So apologies for absence, please.
We've received apologies from Councillor Moriarty, Councillor Dedman and Councillor Salmon this evening.
And any substitute members?
Yes, we have Councillor Carr-Brown substituting for Councillor Moriarty.
And I ask, as I usually do at these meetings, for declarations of interest, please. Councillor Allen.
Declaration says that I have a contract with University Hospitals Dorset, and I also work with the Health Bus Trust. Thanks.
Thank you much, everybody. Can we look at item 4 then, please, the confirmation of the minutes? So unless anybody indicates otherwise, may I assume that those minutes held on the 14th of July are acceptable as a correct record, please? Everybody content? Thank you very much indeed. And again, the action sheet is there just for noting. So unless there's anything that anybody wants to raise on that, I will take it as read. Okay, thank you very much, everyone. Are there any public issues?
No, we haven't received any tonight.
Okay, thank you. That moves us on then to item 6, which is the GET, Dorset and BCP working plan. Just by way of introduction, before I ask Sarah to help us with this presentation and Amina to help us with this presentation, perhaps you just explain that this issue is due to go to Cabinet next week, and the chairs of various scrutiny committees were asked about what arrangements should be made for scrutiny, bearing in mind that the issue is quite cross-cutting, cuts across a number of different committees, a number of different services. And the outcome of that was that it was agreed it would come here to health and adult social care. But I'm very grateful to Councillor Kate Salmon, who sat at the back, who's the chair of Overview and Scrutiny Board, for helping with that. And Kate, if you want to say anything, just wave at me. Be pleased to hear anything you want to add. So that's the background. There are, as the paper I think outlines, and as I think will become clear, there are a couple of elements to this. One is the Connect to Work programme, which Sarah's going to help us with, but also the broader Get Dorset and BCP working plan itself, which is what is going to go to Cabinet next week, and which BCP and Dorset jointly need to submit to the government by the end of the month. So timescales not necessarily helpful from our point of view, but that's just by way of background. So with that, Sarah, may I hand over to you, please?
Could I have permission just to share the screen? Is that okay? Got a presentation for you.
Yeah, of course, that's no problem.
Can everybody see the screen okay? Thank you. So I'm going to hand over to Rosie Napper, Dorset Chamber, to begin the presentation, if that's okay.
Thanks, Amy. Thank you. I was going to say, could you put that slide up? Thank you. I'm here from Dorset Chamber, who've been commissioned by Dorset and BCP councils to prepare this draft plan for you. It is really, there's some key bits on there, and you'll have received the plan as part of your meeting notes. As you've heard, this is every area has been asked to prepare this plan. So it's a national initiative. Basically, the plan is really thinking about who can work and who wants to work. So it's thinking about how do we support the employment rate in the area by looking at the systems that are in place to help those who can work and who want to work. So those who are unemployed or who are economically inactive and want to work into work. So we've done a huge piece of work over the last few months, talking to many services and through the council services and commissioned by councils, as well as talking to the ICB, the NHS and Job Centre to understand what the current system looks like. Now, it's really important that I mention as this plan that there's no additional money that goes with this plan. So there is a plan. It comes with actions that cover the next 2 to 3 years, as well as a 10-year vision that's really thinking about how can we think about the systems that procure and make sure that they align well so that we can really focus on making sure that those who want to work get back into work. I think the other bit to mention is that Sarah's going to talk about Connect to Work, which is the funded part. That's the doing part of this. So I'm happy to take any questions that you've got on this, but now I'm going to hand over to Sarah.
Okay, thank you. So really a key plank in the Get Britain Working overarching policy is the creation of Connect to Work, a supported employment service, a high fidelity supported employment service that's being delivered across the country in each local authority area. And each area is looking a little bit different. So it's the first time that funding has been devolved to local authorities in this way to design a very local programme that suits local people, local businesses and the local skills gaps and needs in the area. So it's funded by the DWP, funded through from 2025 to 2030. Dorset Council is actually the accountable body for this piece of work, but the plan has to have, the whole service has to include BCP. So we've been working collaboratively on this, and because skills and learning is a shared service between Dorset Council and BCP, we were kind of chosen to lead on the development of this particular piece of work. So we've been working again with local partners and businesses and stakeholders and potential referral partners to design a service for the local area that is going to sit alongside and complement skills and learning adult community education as the adult learning service. We're already working with quite a few of the same target participant group, and we're already working with employers and a range of the stakeholders involved. So the service will primarily help economically inactive residents who are age 18 plus, and it's those with disabilities and health conditions. But there are also a broader range of individuals with more complex barriers to work in certain disadvantaged groups, and so they will also be able to participate in this programme. It's economically inactive, currently outside of the labour market, but it's a voluntary programme for people who wish to be in employment. And the funding that's provided from DWP will allow us to create and run this service, and I guess the simple version is it allows us to recruit a team of employment specialists who will work to provide tailored individual support to these participants, and will support employers to job match, profile match, make sure that the right people get into the right vacancies, and to continue to support those individuals and the employers for up to a year on programme to make sure that the fit is right for everyone. So really it's about sustaining that employment once we can help people find it. Slightly different to previous programmes in that the support happens after the employment's been found, or continues after the employment's been found, rather than all the stuff that sometimes happens beforehand. So we have a very draft plan at the moment that is being submitted to the DWP at the end of September for a bit further feedback. And it's going to Dorset Council Cabinet on the 9th of October for agreement that we can kind of continue with the plan as it is and get everything signed off as necessary. So end of September is our next key date. We'll be looking to launch the service in January 2026. But we will have to involve some commission delivery partners in the delivery of this because we need to achieve reach up to 900 participants across Dorset and BCP a year. So that's looking like a split of 500 in BCP and 400 in Dorset. So yeah, end of October for some procurement activity. We'll go live in January, but then delivery partners will come on board from the end of March. And again, I'm happy to take any more questions or kind of share further details as may be necessary.
Thank you very much. Does anybody else, just looking at the officers really, does anybody else want to add anything at this point in terms of either the Connect Work or the broader plan? Does anybody else want to add anything before I start asking colleagues if they've got any questions? Okay, if not, then I'll open it up to those who might have questions. Any starters for 10? Perhaps I might ask by way of starting the process off. One of the reasons that I was particularly keen for it to come here was to see or to try and understand where the connection is between the white paper, which I kind of know what it says on the tin, and how we're actually going to deliver it within BCP. So the fact that it's a joint initiative with Dorset makes it slightly cloudier from my rather parochial point of view. So you forgive me for that. But it's the connection with health that I'm concerned about, and how we are going to persuade, involve the ICB and others within the health service to do what it is that we're asking to do in terms of trying to create something which is joined up, and to create a single service, if I can describe it in that way, because the health component does seem to be quite important, but I'm not sure I can see quite how it fits. So I don't know whether that's something you might be able to help with. Thank you.
Yeah, so I can report that this has been into the ICB board recently, who were very supportive of it, particularly because of its collaborative nature and how it fits into the healthy population. So there's certainly great support from that side.
Amina, thank you. No, thank you, Amina. Sorry, Sarah. Amina.
Thank you. Just to say, this is going to come under the governance of the Dorset Skills and Workforce Board, which includes representatives from a number of agencies, including ICB. So Rosie has been round to all the different stakeholders, gathered views, intelligence in terms of the systems and how it works, and then looking at the labour market. So that this plan will come under the remit of that board as well. So that joins up Dorset and BCP Council as well as the health agencies.
Okay, sorry, Rosie, I got you off there.
I was just going to add that also we've been engaging with the local Dorset NHS widening participation working group as well, and that's linked us in with a range of organisations, support services, and the colleges and the universities and anyone else really who needs to be involved in this, to make sure that we are getting the right people around the table to design and deliver this programme going forward. That's specifically for the Connect to Work piece.
Well, thank you, Sarah. Any other questions from colleagues? Councillor Carl-Brown.
Very kindly offered for other ONS committees to make comment on this, and I just wanted to raise, so I chair the Children's Services Overview and Scrutiny Committee, and I just wanted to, I suppose, reflect really on the subject of apprenticeships within this, because obviously that's something that is very much, sort of post-18 issue for young people. There are some indicators sort of going in the right direction, but there are perhaps too many also going in the wrong direction for our area. And I suppose I just make a bid for more apprenticeships. What can we do to really grow that market, and sort of suffuse the 3 universities that we have with a strong interest in offering those, and also the range of courses, perhaps at FE, the different qualifications, because we've got clear data in here that tells us where our young people are going and not going. And so we need to match that to also up our productivity, which we can see is not where it should be, and get those 2 things working together. Thank you.
Please.
Thank you. This plan also sits, as part, as Amina mentioned, this sits under the Dorset Skills and Workforce Board. This plan, as I said, is very much about those who can and want to work. There's another plan, sorry, we're a plan-rich environment at the moment, that's called the Local Skills Improvement Plan, which very much focuses on employers' skills needs and how do we support employers to get involved with the skills system in order to make sure that the skills system turns. That plan very much fits in with all the ambitions that you've just stated. That's held by the Skills and Workforce Board. How can we support growth in the area? Again, how can we support the growth in apprenticeships? all of those will sit under the local areas growth plans. So BCP will have a plan, and Dorset Council has a plan. So we are going into a very coordinated space, and this fits into that, really, that collaboration piece, where we have done a huge amount of work with partners, as colleagues have said, to ensure that we are sharing all the data, the very rich data that has come from this plan and the local skills improvement plan, the growth plans, to ensure that we all understand the vision and how we move forwards. So I hope that answers your question.
Oh, Councillor.
Thank you for explaining the governance around this, which is excellent. I'd just like to ask you, how do you see this impacting an individual who wants to go back to work, who might have some mental health issues coming out of COVID, or might have a chronic long-term condition? How you're going to help employers to, make the necessary adjustments for that person? So thank you for the plan, but I'd really like to know where you see that actually impact an individual. Thank you.
Yeah, thank you for that. And that is the intention of the Connect to Work service, is to make sure that it's a very bespoke, tailored support for the individual that's going to have wraparound support for things like benefits, counselling and guidance as well, helping individuals to see how they will be better off in work, and then also linking them and signposting them to other sources of support as well to help with, we know people will potentially have housing concerns as well. They may be having other kind of family challenges and difficulties. So this is supposed to be a holistic service that doesn't just help with getting them into a job and then saying goodbye. It is supposed to continue with that wraparound support and making sure that if we can't help them, then we know someone who can. We're going to be providing a kind of single front door information, advice and guidance approach, so that anyone coming through that front door will be signposted to the correct support that they need at that time, even if it's not directly onto the Connect to Work programme initially, and they might need something else first. They might need more health support first before coming onto the programme. So it should, if it all works well, then it will provide that support through this dedicated employment specialist who will get to know that individual. The individual tells their story once, that employment specialist understands that, they're the liaison with the employer and then potentially with the other support services that may be involved as well. So it really is about them sustaining that employment then, that is an ultimate aim of this. And I should have said earlier, this is about paid employment as well. So apprenticeships are a successful outcome because that is paid employment. So it's a really nice link up with that as well.
And just going on from that, have you got buy-in from employers? Because I mentioned, sometimes it's not just about the person's, ability to start making that step to going back to work, but it's often about that they will have needs and their employers will have to make appropriate adjustments, and you've got to have the buy-in from the employers to be able to deliver that. And in a big organisation that might not be too difficult. In a smaller organisation that might be really challenging. So I just wonder what partnership you're having with the potential people that you're going to be putting people into employment with.
We recognise this is going to be one of the most challenging aspects of the programme. We also know through the research that's been happening as part of the Get Dorset and BCP working, there is an element of employer fatigue as well, with being approached about supporting lots of people in lots of different ways, providing work experience opportunities, apprenticeship opportunities, support internships. So one of the systemic changes that's proposed in the Get Dorset and BCP working plan is to have more like a coordinated single front door for employers as well, that they can find out the information that they need to do, to consider all these approaches. We're looking at also approaches about how they can fill their future skills gap. We know we've got an ageing work population as well, and so there will be emerging skills gaps. So it's designed to ramp up a bit. We're not expecting to have 900 vacancies in year one that we can slot people into nicely straight away. So it will take some work. It's going to need a lot of support for employers. We'll be providing the support for them to become disability confident employers as well. We'll be providing some additional support for their workforce as well to make the necessary changes and adaptations to accommodate and welcome someone in their workplace. It's certainly not going to be easy though, and it'd be very naive to think that we're just going to be able to get up and running with this straight away. So through the Dorset Chamber and the various other groups that have been working with us on this, then we're getting that exposure to employers, and both authorities and the NHS need to lead by example on this, and to show that we're actively involved in offering supported work placement, employment opportunities, not work placements. Got to use the right language. Okay.
Thank you. Councillor Salmon, I think.
Thank you, Chair. Similarly to Councillor Carr-Brown, I'm coming to this as a result of us discussing the cross-cutting nature, as you mentioned at the beginning, and I've asked the board and the Overview and Scrutiny Board members to give me any thoughts they had, and I'm bringing those. So I'm going to sort of present a few observations and things that the board members have asked me to bring, a few of my own as well. And I just want to start by saying it's an amazingly impressive bit of work. Clearly a lot of work's gone into it. So I don't want this to come across as criticism, and I hope it doesn't, but a few thoughts and ideas that people have put to me, if that's okay. Personally, I particularly welcome the references in the plan to improving the quality of work that's available across Dorset County. The plan notes that 11% of people in employment in our area are currently being paid below the real living wage. And really interestingly, I came across the figure that 11% of the people attending food banks across the country are also in work. So that's an interesting comparator, isn't it? And actually just this afternoon I got an email from Citizens Advice which announced their new out-of-hours debt advice centre, which is aimed at making debt crisis services available outside of the working day. So it's really very clear to me that there should be a strong focus on this piece in this piece of work, on ensuring that when someone does access employment, that employment promotes a basic decent standard of living. There's a suggestion linked to that point that it might be worth engaging with the new BCP Poverty Truth Commission, the second iteration of that's just recently got started. Well, it's got started in the spring, but they had a public event that I went to a couple of weeks ago, and I know that Councillor Carr-Brown is one of the civic commissioners, for example. So it would be, I would have thought, really useful to potentially bring those people into this and take those voices from those people with lived experience into account here. Another thing that I noted was that at times the document refers to various economically inactive groups of people, for example, unpaid carers, including parents, students, and people who've taken early retirement. And it appears to seek to reduce their numbers in pursuit of higher rates of employment. And it might be that that's not always what's meant, but that sense comes across to me in the language. And I think that it's particularly true in relation to the discussions about getting parents into work. There slightly seems to be an assumption that it's best for all parents to be in paid employment in all cases. And I'd say that speaks to maybe an underlying assumption that I would question about the value of unpaid work. Choosing to raise children or to take early retirement, for example, volunteer, should be treated as valid choices and given equal status in society. And another suggestion that's come through from the board, that the plan could potentially include a proposal to pilot a universal basic income scheme of some kind, which is a model that helps give unpaid work an economic value. I don't want to go on too long. Forgive me, Chair. I've got one more point to make, if that's all right. So another suggestion that was raised was around having a greater emphasis on the benefits of promoting work with locally owned companies. So ones where the profits from the company stay within the area and benefit Dorset, rather than being siphoned off to larger national or multinational entities. organisations that are fixed in Dorset, such as our universities and colleges, healthcare services, local authorities, the schools, have a role to play here in terms of prioritising local procurement to strengthen local companies as employers and thereby secure more local jobs, which I thought was a useful point. And I will leave it there. Don't want to take up too much of your time.
There's a lot there. Do you want to respond to any of it?
Thank you. Thank you for those points. That's very helpful. We did seek to engage with as many voices as we could over the summer, but as you've heard, this was a time-limited piece of work, so there was an aspect to that there. But we'll certainly look at engaging with the BCP Poverty Truth Commission. It's always good to listen to more voices. We will need to try and keep to the timelines that have been proposed, and there is the possibility of the Connect to Work scheme and how that those voices might influence that work that will be on the ground. The BCP, no, sorry. The Get Dorset and BCP working plan is that vision piece, that longer term vision, and that those shorter term actions for those who currently engage in the system. So why am I mentioning that? Economically inactive, we have been asked, the plan does seek to look at that particular group, and I personally totally agree with you, there is a value to unpaid work. We are looking at those who can work and those who want to work, and those who are closest to the labour market in that respect. When we're talking about increasing the employment rate to 80%, that doesn't assume that all of those people will be engaged in work. We do have a higher number of economically inactive people in the local area than who want to work than nationally. So we do know that there is, we expect that we, within that group, we will be able to achieve the plan's targets, assuming economic conditions continue as they currently are to some extent. So I think those are the main points. I can take back your suggestion about in the universal basic income scheme. That sounds very interesting, but so I'm happy to take that back for consideration. And certainly, Sarah mentioned earlier about how we use local stakeholders like the NHS and councils in order to model that and role model those practices. That's certainly something that we support through the Dorset Skills and Workforce Board, and we will continue to be looking for local businesses, continue sharing local employers' stories and in engaging local employers in that way. I hope that's answered some of your comments.
I've got some other speakers, but was it just to add to that point, yes, please?
I think the universal basic income thing is really interesting from a kind of a working perspective. Obviously, we have to send this off to the Department for Work and Pensions. Sorry, I'm in between departments in my head at the moment, so I might pick the wrong one. But I think it's certainly a proposal we could ask them whether it might be viable in something like this and see what kind of response we get.
Sorry, and I just wanted to add that I think, as Rose has outlined, we've had some quite restricted timescales in terms of producing a report, and the guidance only came out in March. But actually, the success of the plan is about it being iterative and adaptive. And part of the work that we're doing at the moment is that analysis and that mapping. And actually, the ideas that you've proposed are something really useful for us to have a think about, particularly the Poverty Truth Lab. But I think it will only be successful if we keep updating it as we get more insight into the labour market and those systems.
Thank you. So I've got a number of speakers on my list. So Councillor Northover, Councillor Cabral and Councillor Farr. I'll take those, and then what I'd like to do is just have a reflection on where we go in terms of the recommendations. I'll add Councillor Brown onto my list. Councillor Northover.
Thank you. I just wanted to raise something that I've seen time and time again, which is that a great number of people don't achieve GCSE maths and English. It's a really quite huge percentage, but then so much of what then is on offer for training, courses, apprenticeships then become completely blocked off. And, you know, young people might drift for a little bit and then they might go, oh, I'm going to go and sign up for a course. And then they realise, you know, maybe I want to become an electrician. No, you can't, because you've got to, first of all, do this maths and English. And say if it's this time of year, we've just missed September. So now it's waiting for maybe January, February. And it's just, and these are quite often people who are absolutely fine and could perfectly capable. It's not that they haven't got maths English skills. It's just that they were mucking around or something, you know, at the time. And I just see it all the time, something that is just this real barrier, and it seems so unnecessary. And if there was a way that we could perhaps assess people and give them something to get over that could be quite quick, rather than signing up to something that's maybe once a week for 8 months or something, just to show that you can speak and write, which you could in the first place. So I just wanted to raise that as something that I hope we could find a way to tackle, because I think it's quite a big thing. Yeah.
Yeah, please.
Yeah, if you're okay for me to respond to that one. This is why I was particularly interested in Connect to Work being a complementary service to Skills and Learning, the adult community education service, because for anyone who is 19 plus, or even actually 18, we could look to, functional skills qualifications are certainly suitable equivalents to the GCSEs, and you can start those at any time of the year. They're not as intensive as you're describing, but we will always respond to what the need and demand is. And if there is a need and demand for more intensive courses, then we would certainly give people that opportunity. So functional skills through to level 2 is also suitable for apprenticeships. And they have slightly changed the rules around English and maths on apprenticeships as well, so that fewer people are blocked now from that opportunity. But definitely send everyone our way, because that's my bread and butter. That's kind of what we do on a daily basis. So it is there, but we probably just need to make that a bit better known, that exists and that people can come through that. So we would be hoping to refer people who come through that single front door, and if they haven't got those English and maths skills, whilst we're trying to sort out employment for them, we would certainly be encouraging them to do the English, maths, digital, ESOL, whatever else might be required.
Can I ask? So if somebody turned up tomorrow, how long might that take?
There's some online ones that are available to kind of join at different times, but it probably would be the next half term, realistically, people joining into groups that have just got established. But there are always ways around it. There's always ways that we can support with individual learning plans to get someone up and running until they can join a mainstream course.
Was it on that point, Richard?
Yes, it was. It's just it is overlaps with that point, because you know I know Councillor Northover has mentioned this before. Strangely enough, over this weekend I was discussing exactly this point with some leaders from colleges of further education, and they are also aware of it and also understand the funding implications and problems, and they are going back to lobby to see whether that can be changed. So it's not directly relevant to this, but I thought you'd be interested.
Councillor Carr-Brown.
Thank you. Yes, and of course it is changing, as you just said, which is really good to hear, because I agree with you. I think that's a really important point. I just wanted to come to the specialist send report section, which is very short, and I wondered if it was perhaps, if there was more coming on that. There's a paragraph that just says about there's a range of education and training providers, including specialist provision, and I just wondered if that was going to be fleshed out at all. And also I just wanted to mention, because it then says about supporting, including travel assistance and bursaries to aid participation are available. And of course we have this situation where between 16 and 19, that travel support is nowhere near as available, shall we say, as freely available. And I suppose I just wanted to be clear that we, you know, we're across that, and what assistance perhaps could be built into the programme to catch those young people who may not be able to access something without a greater travel assistance. Thank you, Chair.
Councillor Farage, I'll take you first, and then we could perhaps cover those points. Thank you.
I think Councillor Carr-Brown stole my thunder. I was going to sort of ask something similar about, not the fact that not everyone fits in the neat little box, and we've got neurodiverse, population of people who need that extra support. So yeah, just like a bit more of overview on what you've got in plans in place, and have you sort of consulted like local organisations, support groups, etc. Thank you.
Thank you. I'm always pleased to talk about the provision that's available for our SEND population, in particular the neurodiverse. Yes, we could have written a bit more, but it's sometimes how much do you write? We also try to be very inclusive in what we do. I'm personally of the opinion that we try to take an inclusive approach wherever possible. We have got a range of providers and they have been consulted about how we can support the needs. I take your point about travel assistance, particularly for 16 to 19, and that perhaps we can really clarify the language there to make sure that it's clear about that. But we do need to take the timescales into account for this to make sure that it meets the very rapid process that it needs to. 16 to 19 providers do have bursary support that's available, and so that there are some options open to that. So I hope that helps. In terms of the exact Connect to Work conditions, I'll ask Sarah to answer that.
Yes, and with the Connect to Work service, that is for 18 plus. There are a few exceptions around 16, 17 if they're in some of the disadvantaged groups, and that would include care experienced young people where there could be a consideration. I have built money into the grant that's going to be received to help cover some travel costs, but that would be 18 plus. And it wouldn't necessarily last throughout the duration of the year that we might be supporting someone. There's still the Access to Work funding that would be available through DWP and the Flexible Support Fund, I believe, that they can maybe utilise as well, that can help in some of those situations. Obviously, it's conversations with employers as well, and I think it's possibly more of a challenge in the Dorset area, that whole travel piece for young people to get out to them. And the Connect to Work service itself, that it is targeted at those with disabilities, health conditions, and neurodiversity. So that is a very inclusive programme, and that's who we will be working with. So there will be a bit more detail in the Connect to Work plan rather than the overarching Get Dorset and BCP working plan.
Councillor Brown.
Yeah, thank you, Chair, and just thank you to the officers, because we did have a sort of briefing on this a few weeks ago and some conversations about the plan. And apologies, because I've got something I wanted to sort of see whether it's possible to add into the plan, but it's something that's only really come up over the last couple of days, and that's around unpaid carers. In the report, it talks, I think in paragraph 2, about the white paper mentions exclusion from the labour market, among other things, due to caring responsibilities. But then in paragraph 21, when it talks about the priorities, the key outcome priorities for Dorset and BCP have been developed, it doesn't talk there about reducing economic inactivity for people with caring responsibilities. So I don't know whether that's something that could be in there. And then also in the plan, particularly in section 3 of the plan, it talks about the drivers and causes of supply and demand. It mentions about female workers, disability, parents, people with health conditions, young people. But again, I'd like to see something explicit about unpaid carers, because I think there's some specific barriers to, not just barriers to being economically active, but actually sustaining work if you've got caring responsibilities. And I know a lot of that's probably down to employers, and employers having more flexible working practices so that people can have work but actually still fulfil their caring responsibilities, whether it's for younger children or whether it's for elderly parents. But yeah, I'd like to see something in that section, something more explicit that's got sort of charts about the number of unpaid carers in Dorset and PCP, their economic activity, and something that actually explicitly puts it in the plan so that we don't lose sight of them. What's actually driven it? I've been at a conference the last few days, and I've actually had a couple of meetings with the Centre for Care at the University of Sheffield, and they've just launched an unpaid carers dashboard, which has got census data from 2011 and 2021. And that includes economic activity of unpaid carers. So you can literally look by local authority, you can look at BCP, you can look at Dorset, how many unpaid carers in the area, their demographic split, their age, their gender, religious beliefs, how many of them are economically active, how that's changed in the 10 years between the censuses, all of that, all the data's there online now. And certainly had conversations with them and they were demonstrating the sort of data that you could get out of it. And I've pointed out, Get Britain Working Plan, that all local authorities are needing to do this. And actually, access to that data set, making available free nationwide, would be really useful for all local authorities, actually. So, yeah, it's just something that's, apologies it's come up over the last couple of days, but there is data there. And I'd like to see something specific in the plan that talks about unpaid carers, their barriers to work, the difficulties they have in sustaining employment, and then the volume of the issue in Dorset and BCP, so, if that's okay. Sorry.
If I can just respond from a Connect to Work point of view, carers and ex-carers are one of the disadvantaged groups that the Connect to Work programme will target. It's actually quite a broad range of disadvantaged groups, so we're hoping that works in our favour, that we can put something together very specifically. But that's really helpful for you to say that tonight before we submit the final paper, because I can certainly make more of a feature of that within the Connect to Work delivery plan and make sure that that's accommodated. It might be that it's something that we look at with a delivery partner, a commission delivery partner. If there's anyone locally who's working with that particular cohort, then that could be something they might be interested in picking up. So thank you. It's really quite timely for my Connect to Work plan, and Rosie from Get Dorset BCP working.
I can take that one away. That's not data that I'm not sure how that's been considered. So I need to find out a bit more about that and look into how we might be able to include it either in the plan or as one of the regular updates as far as that will be monitored through the Dorset Skills and Workforce Board. But certainly take that away. Thank you.
Thank you much. Thank you very much, everybody. Sorry,
just to say, I think it would be really useful because it talks about people with disabilities and health conditions and that sort of thing. But I think unpaid carers really need to be remembered and thought about as a group specifically to make sure that's picked up. So thank you very much.
No, thank you for making it an important point. So thank you very much.
Sorry, Councillor Cannon, I was just going to ask Councillor Brown if maybe if you did have contact details for Sheffield, that would be really helpful for us, because I think that's all the data we can access, but if they put something separate to that, that would be useful. Thank you.
Thank you very much. So what I'd like to do is to move us to the recommendations which are in the paper. These are recommendations to Cabinet. And as I think I mentioned earlier on, and others have commented on, I think it's important. It's a really important piece of work, and we need to get through that next stage, don't we, of getting it signed off through the various cabinets and getting the work underway. What's been in my mind since I read this paper really was whether and how we might be able to bring it back to scrutiny to see how it's going, to look at how it's being delivered, and coming back to Councillor Allen's earlier point, how is it benefiting in the individuals in being able to get back to work. I might have to have a conversation with the chair of Overview and Scrutiny Board about where it goes back to, but I'd like to see it go back somewhere in order for us to be able to see how it's going. So I find some form of words to ask Cabinet if they would agree to asking for that further scrutiny in due course. So it's not going to happen next week for sure, but at some point, probably sometime next year, when the positions become clearer. Councillor Herrick.
I'll just respond. Obviously, you're free to add those thoughts into your board and make that request to Cabinet, but I think we'd certainly be happy to bring something back at an appropriate juncture for examination of progression, because that was a lot of long words, wasn't it? But yeah, you get my gist.
So would members be happy with that? I will find some formal words in a minute, but would members generally be happy that we try and find an opportunity at an appropriate time for it to come back and just see how it's going, see how it's being delivered, and the outcomes that we all, I guess, are hoping will be achieved through this. Is that okay? Okay, thank you very much. So with that then, we'll conclude that item. Without being rude, you're free to go, but if you wish to, but don't feel as though you have to stay if you don't want to. But we'll just take a short break to allow anybody who wants to leave at this stage to leave. So thank you very much, everybody. Thank you, Sarah. Thank you, Rosie, for very much for your time. Thank you for coming. Okay, thank you very much, everyone. We're going to move on now to item 7, which is the Tricuro Business Plan Review and Objectives for 25-26. Very warm welcome to Marion Westall, the Chief Executive Officer of Tricuro, and to Jan Bergman, who's the Chair of the Tricuro Board. So I'm going to hand over to you, if I may, to take us through this presentation. Thank you very much.
Thank you very much, Chair. Good evening, everyone. I'm going to start by handing over to our Chair, Jan, just to give a quick introduction in terms of where we are at the moment, and then I'll run through the slides and our objectives for the coming year. Thank you.
Okay. Good evening, Chairman and committee members. It's good to be here. So I'm the independent chair of Tricuro. I've been in post for about 9 months, and in my day job, I'm a part-time improvement director with NHS England in the independent private providers arm, and also specialist advisor with the Care Quality Commission. The board, we've had quite a few changes. The stability has been with the non-executive directors. We have 3 very, very able ones, and we've recently appointed Marion, who's been here about the same time as I have. There's a clear vision for Tricuro, which is to provide the highest possible care for the services we provide. So when I say highest possible care, that's easy to say, but we want excellent feedback from our clients, from their families. We want to achieve CQC outstanding marks for the 5 bases where we are judged by the Care Quality Commission. And we also intend to benchmark. Now, social care is very hard to benchmark, but we intend to benchmark against what's called best practice across England and later stage maybe abroad in Europe as well. Some key priorities at the moment are to invest in staff. When I say invest in staff, I mean develop staff. I don't mean just pay more staff, but develop staff. Staff motivation and their well-being is really important because that's passed on to the clients and patients they serve. We're also making some improvements in the governance aspects to the board. So where my experience is mainly in hospitals, is we have a saying, board to ward, and that's something we're introducing in Tricuro as well. So the board is part of the service. We are keen, obviously, to partner BCP. in a very proactive way. We receive fantastic support at the moment from Councillor David Brown and Zena Dighton, who's director with BCP. But we are looking to grow. The budget we have at the moment is £20 million, and if we compare that with Care Dorset, which is £30 million with a smaller population, it is important to grow so we can establish our infrastructure to be able to provide that highest possible care. There are opportunities, and the key message I have today, two key messages really. One, we want to be the best in terms of quality provision, and secondly, we do need to grow, and we need BCP support to be able to do that. And one way of doing that is through the Better Care Fund. So we would like to continue to work closely with David and Zena in hoping to provide more contractual work for BCP.
Thank you, Chair. Just to follow on from that, in terms of what we'd like to run through, just briefly to revisit and recap on progress on the business plan that I believe was presented to this committee about a year ago. Tricura has been through quite a period of flux and restructuring since then, so it's well worth making sure that we're reviewing and assessing what we do. And there's been quite a few changes in the senior leadership team as well, so that's really important from our perspective that we're making sure we're not losing the lessons learned as we go. I was asked to ensure that we brought to the committee a quick overview of the numbers of people that we support. As you will appreciate, there are people moving through our services quite often, and therefore this is a snapshot on this slide at any particular point in time. Some of these numbers are more static, for example, in our residential services. Some are much more fluid. Our reablement services, for example, people are moving through those for short periods of support, and therefore the residential reablement service, as an example, will support several hundred people in the course of a year. But this gives you a little bit of a flavour. A number of our services are absolutely at capacity. Certainly all of our residential ones pretty much are. One or two of our day services have got a little bit more capacity. Some of the referrals, where there was a bit of a freeze whilst we restructured those last year, have been a little bit slower to get going again. More down is a particular one that where it's a little bit under capacity at the moment, and we're obviously talking to our colleagues in commissioning about how we move forwards with that to give everyone a little bit of a sense of how we can progress. In terms of last year moving into this year, there were two really key areas. Day services underwent a fairly substantial structure change, and they were streamlined. We navigated a reasonable amount of activity around what roles would remain, what colleagues we could retain, and whilst actually we were able to mitigate dramatically the number of roles put at risk. By definition, because of the amount of change, we did lose some colleagues who had a lot of experience, and therefore part of what we've been doing is rebuilding that skill set as we go. That structure in our day services has been in place since January. We're just reviewing that and about to go out and seek some feedback from our service users and their carers as to how that's working and whether what we're providing supports their needs and objectives. There's also been quite a lot of work in the reablement space, both in community and residentially. That service was also reshaped. That structure has been going since March, and the pilot that we're currently running in the residential service around future cares, I believe, is going quite well, and lots of good learning coming from that, which is really useful. And the team have been very keen to participate in that. So I think some of these areas are where we feel we've made progress. That piece around where we're going with our intermediate care, there's still some work to be done. We've currently got a working party that has been established with commissioning around how we review our referral process and how we can improve that throughput of people in those services and their outcomes. We've improved our quality assurance processes, and we are just about to appoint somebody to lead in that space. And there's been quite a lot of investment in reporting to ensure that we've got a strong framework for review to give ourselves assurance, which I think wasn't there before, and our board have been very clear that that's important for us going forwards. Digital transformation, there's been quite a lot of work in this space, and this is very broad. This will include anything from the KPI dashboards through Power BI and Fabric that we're now using, to online training for staff, to electronic care planning in some of our regulated services, to an assistive technology partnership with the Arts University in Bournemouth, and also the beginning to explore the opportunity to use AI. So there's quite a lot of activity in that space. The areas where I think we feel and we recognise that maybe we haven't progressed as much, and therefore are very much part of what we seek to focus on going forwards, is how we ensure that Tricuro's vision, mission and purpose is very much aligned with the Council's vision and also adult social care strategy. And key areas of that are around how we optimise that intermediate care support, that reablement support, as we can see that there is growing demand, how we improve the employment support offering and pathway that we currently have, and how we are much more effective in our partnership initiatives going forwards, particularly in our community spaces and services. In the start of this year, having joined the team relatively at the beginning of the year, and also with a new finance director and a new head of people, we sought very quickly to reaffirm Tricuro's vision and mission in collaboration with all of our workforce. So that was a very consultative approach to make sure that everyone had a clear understanding of the direction that we sought to go in. And obviously it's very clear that we, as I mentioned, seek to be very aligned with adult social care's core objectives. So that's very much part of our discussion. As an output of that, what we've established in the short term is 5 core areas of focus for us for the next 5 years. And I'll just provide a little bit of information behind each of these, but we felt that these were really key to Tricuro's ongoing progress and success. What that starts to look like, certainly in the short term, the piece around high quality care and support is about stabilising all of our services, ensuring that we've got really good consistency after a year of real flux, and it's really important not to underestimate the impact of that period of flux. With changes in leadership, with changes in structure, with changes in funding. So I'm very clear that this year is very much one where we stabilise, where we review, and where we then plan to build and grow. And we're really clear that that needs to happen very much in terms of both assuring ourselves of our quality metrics and processes, but very much working in co-production with our service users. Inevitably, the finances play a substantial part, and we're working really hard in this space. We're very clear that we need to make sure that we are financially viable, that we are not running at any substantial deficit in running our services, and that we exploit the opportunities we have to grow income both within our existing services and also through the opportunities that may present themselves in terms of new business, as well as ensuring that we're operating extremely cost effectively. We're investing a substantial amount of time and effort and input into our workforce. We're very clear that success in this space is by ensuring that our colleagues feel empowered and enabled to bring their skills and their expertise. They are the people on the front line supporting our service users all of the time. They have the knowledge and the expertise as to how best to do that and how to innovate and how to effect change. And therefore it's really important to us that they are feel that they are working in an environment where they are listened to, where they have the support that they need, the tools to develop, and that their input is recognised. There's a lot of progress in this space. Most of those objectives are either already complete and well underway, and I'm really pleased with the responses we're getting from the workforce in terms of how they are engaging with us. As Jan touched on, we're very clear that we need to ensure that governance is very robust. For us, that's about transparency. That's about making sure that people can clearly understand from the top to the bottom of the organisation and back again exactly where the accountabilities lie, who's dealing with what, and how we measure progress and how we measure success and how we manage risk. And there is quite a lot of work going into this space, as well as building the longer term plan. Finally, on pretty much the end of our in terms of our objectives, we're very clear that obviously how we work with our colleagues in commissioning, with our colleagues in estates, with our colleagues elsewhere across BCP really facilitates efficiencies and improvements across what we can deliver. So we're really keen to make sure that we can get in place. We're obviously just in the progress of completing our 5-year funding contract, and continuing to participate in projects such as Future Cares are very important to us, and how we can engage in those conversations and bring the expertise that we have in terms of the services that we currently deliver. And finally, just to flag that we're very much alert to the potential risks and opportunities that we need to keep on our very much in sight. We do have some risks. I think particularly we would see one of our major risks would be some of the challenges in some of our buildings 3 of our residential services run in buildings currently that are really beyond their useful life and or not providing an environment compatible with the council's strategic aspirations in how we support people to live independently with choice and through an empowered model. And some of our day service hubs are definitely struggling in terms of the quality of the building. So that's definitely an issue for us, as is being able to function at a level where we get the economies of scale that mean that we're very operationally lean and efficient. But equally, having been through the process that we have been through in the last year, I do think that Tricura is now in a very good position. It's improving every month in terms of how it's functioning. It is now well set for growth, and therefore clearly that sets us poised to really look at where the opportunities come from here. I'm going to stop there, but I'm very happy to take any questions. Thank you.
Thank you. I'll ask questions. Could you just clarify that very last point about charitable entity?
Yes, absolutely. Absolutely not intending to just gloss over anything that may be considered a major. A number of our services do community, essentially local level fundraising, and essentially have some funds for the benefit of clients, residents, and their families. And what we're aware of is that currently the way we structure that is not terribly effective. That there is opportunity at a relatively low level if we had the benefit of something like some sort of an entity such as a community interest company or something like that, that actually would facilitate getting better engagement in local partnerships and support from local businesses and beyond.
Okay, thank you. That's Matthews.
Yeah, thank you, Chair. Yeah, it's really useful, the great report and so on, and it's really useful seeing the numbers of people that have been supported by you. You did make some reference to capacity, that you're below capacity on Morden. I'm just wondering, is it possible for us to have some information of the capacity on the services, just to give us some sort of indication of how it's going? That would just be used for future reference. That'd be quite useful data. Thank you.
Absolutely, very happy to. I don't have the detail of that data to hand, but certainly we can take a look. This is all part of the dashboards that we share, so we can certainly pull that forwards and bring that to the committee. Absolutely happy to circulate that.
Thank you, Betty.
Yeah, hi, thank you for that. That was really helpful. I don't think I've met you before. I'm Betty. I'm the Director of Adult Social Care in the Council. I think it's interesting to see where the journey has been over the last 10, 12 months. And I'm interested to kind of have a conversation more around future care. I'm the SRO for the intermediate care group within future care, and do work with your teams, Bianca, and other people such as that. I think there is real scope for maybe something to come back to committee around trajectories of what might be KPIs that we might set in the future. What are our targets in the future around how do we get to a much more offer of recovery as opposed to going in and putting in traditional methods of care. We all know that within the 10-year plan, it's all about prevention. And, some of you know that more than others because of the environments that you work in your daily jobs as well. And we are certainly keen within adults, and Councillor Brown particularly, as our portfolio holder, has got a particular interest in prevention and supporting people before we get to crisis point, as do we. So I'm really interested to see some of those projections around, if we were to invest, what would that achieve and in what particular areas? Because I think it is all about prevention. And it is all about getting in there early. It's not about crisis management or picking things up, but it's also about being really dynamic and diverse within the environments and the communities that we have within our 3 towns, because they are very different. And we are trying to move away from models of care that create dependency rather than encourage and enable and work alongside the individuals. So I'm really interested to kind of see something on those areas where there's scope to do more, just around what that might look like. Because if we're going to look at reinvesting from our long-term funding pots into short-term, and we know we want to do more short-term interventions, because when we worked with the LGA, We know that's the area, and that's all again about prevention, but we need to see the evidence that's going to bring us there, and we need to know that we're not going to be paying twice. You know, we need to get the value for the money. So I'm really pleased to hear that that's what your focus is going to be going forward. And also just to acknowledge that your vision is aligned to the adult social care one. It looks like you've taken it from the adult social care, which you may well have done. So that's really helpful to see that that really aligns, and then that aligns to the adult social care strategy as well. So I think you're part of the way there with all of that anyway. And of course they need to be totally aligned. So some interesting stuff and real potential going forward. Thank you.
Thank you for that. That's really helpful. Very happy to come back to put more detail around some of those points. Betty, that would be very much our pleasure. I mean, just a couple of thoughts in response to that. Completely agree with you about how we can work in the preventative space. Just one or two immediate examples and thoughts. One of the things we're currently looking at in Moordown is the development of a dementia hub model, which would see us supporting carers, providing information and advice of carers of people living with dementia, and that's very much around that recognition and acceptance of living with somebody dealing with dementia, how we create a better pathway for them so that actually they get the support they need earlier to better improve the quality of living, to allow people to stay at home more often. That's one. Obviously, as you know, the reablement piece is really key. We're having some really good conversations in the workshop that Zena and Yvette have convened around how we can improve that referral process, how we make sure that people coming through those services, both in the at-home service and the residential services, actually benefit most, and with that and alongside that, look at, so for us that's around maintaining the pipeline, maintaining the capacity. We're also very keen to look at the KPIs that we're using that aren't just around the operational delivery and performance of the services, but actually are around people's outcomes, and very clearly looking at areas beyond just actually where do they end up, but more around, have we improved people's confidence, have we improved their independence, have we improved their mobility, and really start to benchmark those, because I think that would be really valuable to understand how that would be the real evidence that we're seeking. There's more I could say on that, but I think I'll stop there, but really happy to bring back more of that into your course. Thank you.
Thank you very much indeed. Just looking, are there any other questions? Councillor Richards.
Okay, yeah. Yes, there's a sentence there, we work with partners to ensure everyone has a safe place they can call home. Can you elaborate on that a bit?
Yes, let's appreciate that's a very broad, statement. We're very clear that wherever people are spending time, that they need to feel safe, and that they need to feel comfortable, and that they need, even if it's not their home, that it is somewhere where they feel at home. And for us, that is around not just the services that we provide, but where we can collaborate with people. So a particular example might be, for example, the piece around assistive technology and how that might help somebody navigate use of a space in a way that gives them, so you know, in our day services, for example, they can be very busy, noisy spaces, and we have a real crossover of client groups. So we will have groups with complex learning disabilities alongside people with mental health needs, alongside people living with dementia, and they're all evolving in a similar space. So actually, how can we work with other partners to facilitate that? And then one of the other examples is through expression. So we work closely, we have some funding at the moment from the charity Nordhoff Robbins for music therapy in some of our spaces, and how that allows people to express themselves in a way that they might not otherwise be able to, for example. So it's around how we can do more of that, a great deal more of that, to support people both at home and in the services that we provide. I don't know if that answers your question.
Do you get involved with people, you know, who are in their own home but have no family, and they have those problems?
So not at the moment, and I think actually it just references back the point that Betty made, which is how do we make sure we're reaching people almost before they need the support. And I think that's the piece that we really need to get to as part of our longer term plan. At the moment, we're still very much in the front line of service delivery of people who have already been identified as needing support. So for us, the first step is that broader piece is how do we support the network around them? Because very often, we recognise that the services we provide give people beyond the service user. It gives them respite, it gives them additional sort of space, but we might need to give them more support. And then the further step will be, how do we make sure that people know that we're there, and how do they know how to access us? That's a longer term piece of work. But what it does link into is making sure that we are providing a breadth of different services so that when people are able to connect with us, then actually they have anything they need from us as their needs evolve and progress.
Thank you. Any other questions? Zena.
Yeah, it's not a question, it's just a point of clarity, if that's okay, Chair. Sorry to go back. It's just a little bit about the proposal from Marianne about the charitable arm of Tricuro. We are just updating the shareholder agreement, and we are working with legal colleagues whether that's permissible within that agreement. So just wanted to be able, that proposal's in progress.
Thank you. I won't press you any further because that sounds way too complicated to me. Just reflecting back on when I chaired this meeting, when we had the previous business plan, as you said earlier, about a year ago, there's been absolutely enormous change, both within the organisation and indeed within our own organisation, within BCP to some extent. But it comes back to Councillor Matthew's questions about capacity. I think through the committee and through our discussions, whether it's fulfilled lives, which we'll be talking about in a minute, or whether it's about future care, we kind of know where that demand is going to come. Because of that, we can kind of envisage where that change is needed and what's going to need to happen in order for it to be able to be delivered. So we've been in a situation before with Tricuro where I felt anyway, we've been a little bit reliant on just receiving business plans. Not that we don't want to see them, we'd love to see them, thank you. But it's getting beyond that to understand how it works really, and how we might be able as a council to ensure that we're working as collaboratively and as positively with you as we can, but with the objective of ensuring that at the end of the day, what this is about is delivering an excellent service for the people who need it. So that's the bit. So anything that we might be able to do in between seeing business plans, I think would be very, very gratefully received. Thank you.
Yes, thank you. Completely appreciate that, and completely agree that success lies in that piece around collaborative working. We've already spent some time talking to Zena and the team around where are the council's priorities, where are the areas of growth that they see coming, where are the areas that currently there is a gap. What are the things that we don't need to be providing because there just is a surplus of provision, and I think that will very much inform our plan. So I'd like to think that what we're bringing back to you, reflecting all of the different comments and observations and questions, is a lot more structure around what that roadmap looks like over the years to come and how we achieve that together. So and really happy to make sure that we're updating in whatever format is appropriate for this committee, or more, between plans, between annual sort of updates.
And just to add, it doesn't need a business plan for us to come here. So anytime you wanted to come to report or discuss, more than happy to do so. The relationship with the council is obviously just absolutely paramount to moving forward.
Okay, well, thank you very much. If there's no further questions, thank you both very much indeed for your time and for coming. And again, without wishing to be rude, don't feel as though you have to stay for the rest of the meeting if you don't want to.
Although there is an interesting stuff like prevention.
Okay, well, we're going to move on to item 8, which is adult social care prevention strategy. And I'm going to ask Zena if you would start that, please.
Thank you, Chair. Yes, so I'm really pleased to be able to introduce our first Adult Social Care BCP Council prevention strategy. So prevention is quite a wide term, but for prevention in adult social care, it's about helping people to remain independent, healthy, and well for longer. So it's about delaying or reducing the need for more intensive care. So Emma Senior, who's our Commissioner Manager for Prevention and Wellbeing, has a short presentation for you. So I hope, so if I hand over to Emma, thank you.
Thank you, Zena. So first of all, I just wanted to start with why we needed the adult social care prevention strategy.
So, I'm sorry, could you bring the microphone slightly closer? I can't hear you. So sorry.
So just starting with why we needed the adult social care prevention strategy. We're seeing an increase in adult social care demand, and in 2022-23 to 23-24, we saw requests for new support rising 28% for people aged 18 to 64 and 7% for those aged over 65. And we're also seeing an ageing population trend, with BCP Council residents that are over 65 expected to grow 15% by 2028, which would make up 24% of our local population. And living for longer doesn't necessarily mean living well for longer either, because healthy life expectancy is not increasing at the same rate as overall life expectancy. And also with mental health, we're seeing that depression and anxiety are the lead causes of disability amongst the 15 to 49 age group, which accounts for 1/5 of disability in our area. And the BCP resident survey found that around 12% of our residents feel isolated. And there's been a recent meta-analysis of studies on loneliness and isolation, and they found that social isolation increases the risk of all-cause mortality by around 35%. So what we need to do as part of the adult social care transformation is shift our focus to prevention. And preventative services delay, reduce or prevent the need for long-term care and support. And if our residents can live happier, healthier and more independent lives as they age, that will reduce the increasing demand on our adult social care services. And in 2024, the Local Government Association produced a report, Early Action and Support, the Case for Prevention in Adult Social Care and Beyond, which highlighted that early support could save councils £3.17 for every £1 spent on prevention. So to develop the strategy, we engage with our local communities in various different ways via surveys, workshops, focus groups and co-production forums, because we wanted to understand their needs, their preferences, their aspirations and ideas for our approach to prevention. So that included our Your Voice network, the Bournemouth University Peer Network, our People First Forum and lots of different groups, such as the Bournemouth Jewish Support Services. We also engaged with our local provider market, including care providers, our commission services and private support services, because we wanted to understand the market need. And we also really wanted to understand the needs of our own workforce as well. So we met with lots of different adult social care teams, we held colleague events, we did webinars, including occupational therapy, autism, sight and hearing, and with our contact centre. And on the 23rd May, we held our first multi-partner prevention event. So we brought together the voluntary and community sector and our integrated care system colleagues to celebrate best practice. And we hosted workshops to explore key questions about prevention and what our priorities should be for the strategy. So as part of our engagement, we had 180 responses to our surveys. 113 people attended our multi-partner prevention events. We gave over 30 presentations at different events, team meetings and conferences, and met with over 30 voluntary and community sector organisations and community groups. So in total, we had about 400 attendees at our various different events. And through all those events that were attended, and the surveys and the workshops, we asked everybody what prevention in adult social care meant to them. And we combined their responses to create one collective definition, which is that prevention in adult social care means taking early, proactive steps to help people stay healthy, independent and safe for as long as possible. It focuses on supporting well-being, reducing risks and avoiding crises by providing timely information, practical support and community-based services. So by working together with individuals, carers and partners, adult social care helps people make informed choices, stay connected and live well at home, reducing the need for hospital stays or long-term care. And so our strategy has 5 priorities, and I'll go through each one of them and the focus areas. But as you can see on this, at the heart of that is people, carers and the community. So our first priority is a change in culture, and our focus areas are strength-based and holistic approaches, where we want to utilise the skills and talents of people and communities, and that really links well to our 3 conversations model. Equality and diversity, we want to create an inclusive and supportive environment for everybody, and that fits with our new strategic approach to achieving equality, diversity and inclusion in adult social care. And then we have co-production. So we really want to support the implementation of our adult social care co-production strategy. And language and listening. So we really want to use empowering language and address key issues that create barriers in access, and also raise awareness of health literacy. Our second priority is living and ageing well. And the focus areas are falls prevention, strength and balance. So we're going to link in with falls prevention programs across the Bournemouth, Christchurch and Poole area and in different sectors to really share that knowledge with our adult social care practitioners. Better physical health. We want to promote physical activity and we'll work with partners to identify, support and promote physical health programs across our area. Financial stability and security. So we'll work alongside our communities team and other partners to make sure that adults and families have got access to financial assistance and advice so they can maintain a dignified standard of living. And age-friendly communities. We'll continue to work in partnership with our age-friendly network to support the development of age-friendly communities across Bournemouth, Christchurch and Poole. Our third priority is individual resilience to build well-being. And our focus areas are information, advice, guidance and self-education. So we'll promote this through targeted campaigns in various formats using relatable and empowering language. Supporting people with sight and or hearing loss and impairment will ensure timely access to preventative support, accessible services and inclusive community opportunities. Hoarding and self-neglect. We want to work with partners to identify and coordinate multi-agency approaches to reducing risk and promoting safety, well-being and independence for people that hoard and self-neglect. And for self-funders and people on the cusp of eligibility, we want to enhance support for them, for individuals that are nearing those eligibility thresholds, and make sure we've got improved access to information and advice for them. And supporting carers. So we want to support the implementation of our carers strategy and strengthen that early identification and support for carers to help them maintain their caring roles and live well alongside caring. And finally, for this priority, it's occupational therapy and care technology. So we can promote monthly independence and prevent the escalation of care needs by expanding access to occupational therapy and care technology to support daily living. Priority 4 is supporting the workforce. So our focus areas are workforce well-being. We want a resilient, motivated and high-performing workforce that's capable of delivering preventative, high-quality support. We have staff development and training. So we'd like to raise awareness of training for the workforce, such as age-friendly training. And leadership commitment. We'd like to cultivate a strong, compassionate leadership that drives the delivery of preventative, person-centred approaches. And one focus area for us is first, think prevention. And we want that prevention first mindset across the whole of the adult social care workforce by strengthening access to community-based knowledge that really empowers them to act early and innovatively. And the final focus area for priority 4 is integration, collaboration and communication. So we're going to start holding connect and collaborate forums, which will really strengthen our partnerships across health, social care and the community sectors. And the 5th priority is connecting communities. And our focus areas are connection and a sense of belonging. So we want to try and reduce loneliness and isolation by strengthening community cohesion and social connectedness.
We'd like to address health and social inequalities, ensuring that everybody, regardless of their background or circumstance, can access the support they need to live healthier, more independent lives. And community first, we want to prioritise community-based, person-centred support to reduce avoidable admissions, delayed discharges and reliance on long-term care. Safety and security. We'd like to empower residents to maintain their safety and security through community-led safety initiatives. And finally, supporting the voluntary and community sector. We'd like to embed supportive commissioning practices and promote collaborative relationships, ensuring that the sector can thrive and be a key partner with us in prevention and well-being. So alongside the strategy, we've produced an action plan. And that action plan covers each priority area of the strategy in detail and sets out actions, outcomes, measures and timelines for each area. And it aligns with our strategy's 5-year duration, and also provides a clear framework so that we can monitor the progress and measure the impact of the strategy. And most importantly, it includes that collaboration with all our key partners, for example, public health, age-friendly communities, and the voluntary and community sector. But there is one key area of the report that I wanted to draw your attention to, and that's the financial implications. Because at present, there isn't a dedicated fund for preventative services, and we feel that establishing one is critical to the successful implementation of this strategy and to manage that increasing demand on adult social care. So the short-term funding streams for our preventative services at the moment, including one you might know about, which is the BCP handy van service, they're all ending in 2026. And we'd need a minimum of £670,000 a year to be secured to maintain the existing service levels. And if we wanted to fully realise the ambitions of the strategy, we'd need £817,000 per year. But when I mentioned earlier the Local Government Association estimates of £3.17 being saved for every £1 spent, if we were to get that level of funding of the 817,000, we'd actually generate just over 2.5 million in cost avoidance. So finally, our recommendation to the board is to support the recommendation to approve the Adult Social Care Prevention Strategy at Cabinet on the 29th of October, and to also recommend to Cabinet a financial commitment to the delivery of the Adult Social Care Prevention Strategy. And thank you. Any questions?
Well, a number of questions about the money, but one of the things that strikes me about it, I mean, before I'd seen this paper and when we were discussing with certain officers about this coming onto the agenda, because I do this sort of stuff, asked really stupid questions and said, what is it we're trying to prevent? And of course, this sets out what it is we're trying to prevent. But what I don't know, I mean, I can see the structure, but I just don't know how. I just don't understand how we are actually going to be able to make a difference, and that's where I struggle. I understand the theory, but I struggle to see how we're actually going to make a difference for people. and for me, I as a council represent the ward of Boscombe West, and when we were discussing the previous item on getting people back to work, this is a ward with a high level of deprivation. It features in almost every kind of matrix that we look at because of the nature of the ward, along with Councillor Farr's ward in West Ham. And it's an area that needs a coordinated response. I mean, it's not unique, don't get me wrong, but it needs a coordinated response. And we need, as an authority, to be able to, and working with health partners, to be able to join up the dots. And I bang on about this all the time, but there is a danger in my mind about working in silos. And one of the things that we've talked about elsewhere in the past is this whole concept of how do we build communities? How do we ensure that we provide all of these services, all of the health services to the communities that we serve at a place where they can at a place they can access, and that seems to me to be quite a big thing that we have to try and do somehow. So it's really about how we might be able to see how this plan, which is absolutely fine, but how is it going to make a difference to people? How is it going to affect the residents that I represent in my ward? Where, you know, we're talking about 58% of the people that are in work are only in part-time work. So that's a huge level of economic inactivity, huge level of ill health, mental health issues. I want this stuff to work, and I want it to be able to have an impact on those people. So I'm just struggling really to ensure that we can make it work. Councillor Colbrand.
Well, if no one else is going to speak. Yeah, thank you. I thought it was a really interesting paper actually. And a few reflections, I guess. Not really, I don't think I've got a question, but maybe one will form while I'm talking. But no, thank you for it. Actually, when I was reading it, I was thinking, gosh, it felt quite health based, as it were. It's the sort of thing I would have read in the NHS 20, 25 years ago. Maybe they're still producing it in the NHS, but certainly read very similar things, certainly around falls prevention and things like that, you know, just get the right slippers, that sort of thing. And that sort of made me think, gosh, it's kind of moving it down the range, as it were, of where all this kicks in. So actually, I suppose I do have a question around that, which is, so on page 9 of the strategy, you're talking about the various bits, like individual resilience and well-being. You talk about occupational therapy and care technology. And I just thought, what are the options around, like referring into physios, for example, rather than waiting for the NHS to do it? Because I'm guessing physios sit within the NHS. It's exactly your silo working that you were talking about, Councillor Canavan. Because if you've got somebody going into somebody's home, an OT isn't quite, you know, going to do it. Actually, a physio, a sports physio, even, you know, with a knee replacement or something like that, that's maybe, you know, not quite working. Do you know what I mean? There's what are the flexibilities around those edges that we could really kind of start to work properly together with health? Because I'm exactly with you. I don't think we've cracked that remotely yet in terms of really getting the benefits of what we could get from that. So that would be a question. I'm just going to say I've got a point, and I'm really sorry, but I am going to argue the language in this. So you spoke, so it's page 7, you spoke about inclusive language. And then on page 7, you talk about people who have autism. Please change it. I'm autistic. I do not have a disease. Okay? I am autistic. That is what I am. So please, can we have the language of being autistic, not having autism? It's really, I actually think it's really important. I really do. And I get quite upset when I see it. So please. So other than that, thank you very much. Oh, and by the way, compliment on page 8 is the wrong compliment, but there you go.
That's it.
Thank you for that. And I know they'll note the comment that you've made as well. That was really good to point that out. I think that this is a hard nut to crack. And we all know that. Otherwise, we wouldn't still be talking about it. And your reference back to falls prevention, sloppy slippers, hip protectors. I remember doing that when I was a social worker. So, do you know, it is one of the hardest areas to really, really embed because it is about prevention. And it is about doing something before you almost need to do it. And I think that is the challenge here. And, you know, we talk about all of the information that's out there, and nearly everyone in this room will know the quote from the LGA. For every, you know, for every pound, it's £3.17. I mean, I know that, it's embedded in my brain. But the challenge, I think, is there's a mountain of evidence, there's a mountain of information out there, but there's very little that has been done about it. So I think whenever we sit here, all of us will have notions and ideas and concepts about what prevention is. And I think that what we need to do is start with the basics. What is it that we are trying to do for BCP residents? And how are we going to do that collectively as an ICS, integrated care system, which is all partners of every description and every fit? And I think the strategy that Stina and her team have produced begins to set some of the kind of landscape for that. It begins to kind of pull it together into something that is a bit tangible. I think at the minute there isn't anything tangible that we have. I think what I would really encourage the committee to do is to support the concept and the work that needs to happen on prevention. I think also for me, it's about being really mindful of where it fits in. It fits across the whole of the council. Public health, one of the real key areas in public health is around prevention. Adult social care is about prevention. Health, the 10-year plan is totally around prevention. It's around from sicknesses to prevention. That is the whole, one of the key 3 principles within it. So I think, Patrick, I'm trying to answer give you some assurance that your ward and everybody else's ward will see something more tangible. And I think what we need to do is we need to be co-producing what people believe they need in the way of preventative tools and preventative measures. Prevention is about helping people to do it for themselves and to get in quickly to help them to not need long-term interventions that they don't want. So for me, it's all about co-production. It aligns to the co-production piece of work that Emma's also working on, but we don't allocate our funding enough to prevention, and we're not the only one. This is what I've said about a mountain of information, but very little being done. But you almost need to see it working to be able to shift the money. It's that double-edged sword. So I think this is a good starter for town.
Thank you, Councillor Allen.
I was a little bit with Councillor Carr-Brown about feeling like I've been reading about these things and talking about these things for a hell of a long time, which, you know, it's not wrong, but it feels a little bit like that, so I apologise. I think the thing that came across to me that I think is, again, something we've been talking about for a long time and very sad, is this loneliness and isolation. Because I think we all know that people, is it that song, people that need people are the luckiest people in the world, and you just think that, you know, people will not have as good resilience, their mental health will not be as strong, they won't be as happy, physically they won't be as well, because they feel isolated and they feel lonely. And I think that's a real problem in our society. And I think that tackling that nut unlocks so many other potential things. So I would hope that's a really central point in your strategy, because I just think that I think people have amazing potential, but I think society is really quite very insular these days, and I just think there's a lot of lonely people out there. So and it feels like it's been a lot of lonely people for a long time, but I think post-COVID it's got a lot worse, and I think people's resilience is not there anymore. So so I'm not asking a question really, except for just to say, can that really be a central point? Thank you.
Sina.
Yes, thank you. Thanks for all the comments. Yeah, I don't apologise. It is a very ambitious 5-year strategy. It's 5 years, so you know it has to have there's quite a lot of detail in the action plan with the measures, how we're going to do this over the 5 years. And yeah, we have been talking about this for years. I have in my career, and it's because the funding is not sustainable. So you'll see 1 year's funding, 2 years funding. At the end of 2 years, pressures get, within demand, the demand pressures are there. Then preventative services get cut, which is why. But that can't continue because the demand pressures are continuing and they're increasing. The only way we're going to get ahead of the demand is start investing downstream in preventative services. So we are lobbying our health colleagues. One of the issues that we've got is that some of that funding is ceasing from next year. So we are lobbying them around the BCF, the Better Care Fund, about having a line in that around preventative services that fits in with the government's new metrics around the Better Care Fund. We're working with with public health, with Rob, on some services about the commitment of a ring fence budget. That's what we're asking for. If I can identify the funding, that it is ring fence to prevention. So I'm not asking to support funds a substantial amount of money. It's about us trying to find that with our partners, and then that gets ring fenced for prevention, and then obviously supporting that 5-year ambitious strategy.
Thank you. Jan, please.
Prevention being the way forward. Many, and what you said, Chair, about tangibles, and the tangibles actually generally come from staff who work at grassroots level. It would be helpful maybe to have this sort of presentation or similar presentation with Tricuro. We can try to expand and generate some ideas at Tricuro and how we can take some ideas forward. Because the best ideas, in my experience, always come from staff. Or your ideas as well, not your ideas as well, by the way. But my point being, it's helpful to get a lot of input into this.
Yeah, thank you for that. Councillor Northover.
Yeah, I just wanted to. I was just thinking about actually your question earlier about what will people see when this is in action, and it's really hard because nobody thinks they're going to be an old person, and so the messaging and all the effort is put into it's sort of us really, isn't it? And but it needs to be so universal really to kind of get the messaging and get people to understand about doing exercises and things like that. How important it is to be preventative, and quite often we're not the people that actually get into the homes. We're not the people who get to see what's going on. It can be people in the NHS, and they might not really realise that they're the only people who are able to deliver a completely different message about good lighting in the home or something like that. So yeah, I just wanted to acknowledge how I really appreciate how much it is like a really difficult task.
Thank you. Councillor Farr.
Thank you. It's a bit of a difficult one for me. My nan wasn't very long, my grandmother wasn't very long diagnosed with dementia, and she's since gone into a care home. She's not in the local area, but it's quite tough when you see that sort of, happen to your loved one. And but she's done pretty well. She's 99, and it's she's had a very good life, and she used to go to lots of clubs of the British Legion, and even when she was probably still in her 80s, she'd talk about going to go and help the old people, and she was an old person at that time then, really. But sort of obviously thinking locally here in my ward, and I'm sure further afield, there's Prama do a lot of. This is more of a comment rather than a question, I guess. But keeping active and using your mind, your memory, and this sort of thing is a good thing. I've been along to I think it was called the Memory Lane Club, which is organised by Prama, and they do all sorts of games, and it's things about helping you remember things, and they all sort of interact with each other. So they, it might be that they are at home a lot on their own, but then it's a chance. It's probably a bit of respite for their carers, perhaps their sons and daughters who look after them, and I just think that's a good thing to get behind, those sorts of clubs where the elderly that are on their own get out, see others, and do things that are active with their minds, their brains, keep the brain working, and you know, we'll probably get to a point where you're less physically active. Yeah, perhaps, you know, sort of earlier on, it's you want to keep physically active, but there's a point where it's just good to see people and do things. So yeah, anything that can be done to continue with supporting those sort of groups, whether it's via the Prama and other similar organisations, that would be great. Thank you.
Thank you, Councillor Brown.
Yeah, just a bit of a comment because I'm really impressed with the report that we've got put together and the sort of the detailed thinking and co-production, the consultation that's gone on behind it. What I like about it is we're actually putting something down in writing and being explicit about it. I went along to the colleagues event that we had to discuss prevention strategy, and so much of this professionals have been doing all their lives to an extent, you know, and it's just naturally part of the work that we do. I think what's really good is let's be explicit about it. Let's actually put a strategy together. Let's put the detailed plan down there and talk about what we need to do, how we need to measure it, what the outcomes we hope to achieve. Because, and I was speaking to a friend about it, and they said, well, in the sort of police crime area, you know, crime prevention has been something which we've all lived with for decades. You know, we all have alarms and immobilisers on our car, we lock our doors, we keep things safe, we have burglar alarms, whatever. So crime prevention is sort of, over the generations, is something that we all do and we all think about. Same with fire prevention, you know, the fire safety, we all have smoke alarms, we all think about electrical safety, we don't have dodgy wiring, all of that sort of thing. It's just endemically part of what we do as a society. And for me, this is what we need to get to in health and social care, and we're part way there. You know, a lot of people think about, I need to think about how much I drink and you know, eat your 5 a day fruit and veg and those sorts of things. And but we need to. It's almost a societal generational shift that we need to think about. That people think about preventative measures to improve their own well-being, and it talks a lot in the report, doesn't it, about individual resilience to build well-being, about connecting communities, about changes in culture, and those are sort of a generational shift that we need to do. It needs to happen, doesn't it? Because in the next generation, we're not going to be able to afford to keep all these people in the way we've been accustomed to in the past. So it is, for me, it's one of those real societal shifts that we've done crime prevention, and we never finished doing it, but and same with fire prevention, things like that. But this is about health and care prevention, that society needs to sort of get more of the message and actually understand the detail. And so for me, putting it down in writing, putting it in print, actually having some measures is our contribution locally to what we're doing. Nationally, the government have done the 10-year strategy and talking about sickness to prevention. So I think the national government are pushing that agenda. This is our stab at really explicitly pushing it locally. And yeah, I'm keen to push it. But yeah, obviously finances is the big elephant in the room that we need to sort of talk about.
Thank you. I'll take Councillor Matthews and then trying to bring us back to the recommendation.
Thank you, Chair. Excellent report. I think we're all sold on the concept of preventative care and so on. And I think if you just look at it in the wider scheme of things, I've always had an issue with dentistry. Why isn't that available to everybody? Because it can actually save the NHS so much money. So we all know that's a you know, it's just logic. It's common sense. I think nobody can argue against it. I think the difficult sell for people is that the results are not going to be immediate. So this idea of you're going to invest you're going to save £3 for every pound that you spend, absolutely. But that's not going to be immediate, and people look for tangible kind of things and stuff. So I think there's a lot of really good stuff in that. I probably should declare an interest in a sense that Councillor Farr mentioned dementia groups and stuff. My wife actually runs dementia Scene for the Brain groups and stuff throughout Dorset, so I know how important these sort of things are and stuff, and the real sort of impact they have. But yeah, I think it makes absolute sense. I think there's selling it to people, and people expecting immediate returns is the challenge. But in terms as a concept, and I think this idea of age-friendly community, I totally agree with that. But I think we need friendly communities, because that is one of the fundamental things, because that links to the whole thing of loneliness and stuff. If we can somehow, you know, encourage that, that would be a wonderful world, a utopian sort of way forward, perhaps. But yeah, no, I think it makes absolute sense. Thank you.
Thank you very much. Let's come back to the recommendation then, which is that this committee supports the recommendation to Cabinet to approve the adult social care prevention strategy, and that's obviously outlined. What Emma's kindly reminded us of, that it's also important that when it does go to Cabinet, it contains that commitment to the money, because I think that's really critical. And please don't think you have to justify the money in this committee, because it's on, it's sold really. So can I just see if everybody would be content to accept that recommendation as it stands? Okay, thank you very much. I should have declared an interest too, actually, Councillor Matthews, because this report talks about hearing impairment, and I have one, but there you go. I'm going to move on to item 9 on the agenda here, which is the adult. Okay, let's try again. So going to move on to item 9, which is the adult social care fulfilled lives. Thank you very much indeed for coming. So please, if you want to take the opportunity to go, please do, and thanks ever so much for your time. So we are going to move on to item 9, which is the Adult Social Care Fulfilled Lives Transformation Programme, which we have looked at before, and it's coming back again, hopefully to look at some of the aspects we haven't touched on before. But I want to ask both Betty and Tim, who've been kind enough to come in the past to talk about this, to take us through this presentation, please.
Thank you, Chair. So I'm just going to spend a minute just introducing it. Tim is going to talk us through the presentation of Fulfilled Lives and give a programme update where we're at. I guess the key thing that I just wanted to remind committee of is this committee have agreed that they will provide the overview and the scrutiny of the Fulfilled Lives programme, and that things will come here before anything goes to Cabinet or further than that to this committee to be satisfied with whatever the recommendations are that are going to go further. So the last time that we came was just in the early summer, and that was in advance of us bringing the Fulfilled Lives paper back to Cabinet that we shared with this committee in advance of going to Cabinet, so that it would request the release of the second year's funding. If you'll recall, the funding is just under 3 million, but it was broken down into 2 phases, M1.7 and M1.1. So the programme was kicked off with 1.7 million after the diagnostic work that we've been doing through to identify the Fulfilled Lives programme of work. And then in July, just previously, July 25, we brought the paper and the evidence to this group, to this committee, to then bring it to Cabinet in July, who, with the support of both Councillor Brown and Councillor Canavan, was signed off unanimously by Cabinet and was a very well received report and the evidence that accompanied it. So it has come back to you now just to bring a further update on how the programme is progressing. And Tim's going to talk you through a presentation and just the key areas that the committee had asked to look at. Thank you.
Thanks, Betty, and good evening, members. So, as Betty was saying, this is really just an opportunity to bring you up to speed a little bit more with the Fulfilled Lives programme, and in particular the focus, as I believe was requested by the Chair, to look at the Better Short-Term Support Project and the Self-Directed Support Project. As Betty just mentioned, we've clearly now been successful in securing the additional funding that we needed for the programme to continue. I'm just going to very broadly give you a quick update in terms of the overall programme before we sort of do a deeper dive on the self-directed support and the short-term support projects. So the 3 conversations approach that's still rolling out, and we've got all of our teams now will be including in their approach. By the end of this year, hospital social work team is just going live this week, and that will more or less complete all of the teams with their implementation. The changes that we mentioned last time to the adult social care hub, they're expected to launch during October. Just putting the finishing touches to a number of actions that are needed to make sure that is successful. And you'll be hearing shortly from Yvette about a dedicated community reablement service that we've launched last week, and that's a one-year pilot. We'll go through that with you in a bit more detail shortly. As we mentioned before, I think was mentioned by Emma in the previous presentation, we're still seeing new requests for support going up, but I'm pleased to say that through the work that we're doing with the 3 conversations approach, the number of those new requests, or the proportion of those new requests that actually convert into long-term services, is still going down. So that's a good sign that that's having the desired effect. And we are still receiving, very positive feedback from the people that we've been supporting. And I think there are some further stories of difference in the appendices to the paper. So moving on to self-directed support project update. The first thing before I hand over to Siobhan to take us through the next few slides, I just wanted to try and help set the whole context of not just the self-directed support, but also the program overall. So bear with me as I take you through this. There's a few sort of animations just to try and hopefully illustrate the point. So in terms of our 3 conversations approach, what we're encouraging staff to do is resolve as much as we can in terms of people's support needs, either at conversation 1 or conversation 2, avoiding the need wherever possible for long-term support. So by having our conversation 1, ideally we are looking at ways that we can connect people to assets within their community that will provide them with the support that they need. If, however, that isn't going to be enough on its own, and particularly if that person is in a bit of a crisis situation, a hospital admission would be a good example, I suppose, we would use our conversation 2 as a way of connecting them to short-term support, such as reablement, in order to create that sort of stable situation or get them back to a stable situation. If, having done all that, it's apparent that that person will still need some longer term support in order to lead a sort of good life, then we would have our conversation 3. And those 3 conversations in totality effectively make up what we used to call a Care Act assessment. But so basically all of what we're seeing there is Care Act compliant, but it's just a slightly different approach of how we get there. Having done that, we will have established with the individual what outcomes they're looking to achieve and what for them what a fulfilled life would look like. And at that point, we can apply our Care Act eligibility criteria to determine what their what support and care and support plan will look like. And around them, then we can start to talk about the personal budget options, the way that we would fund and support their longer term support. And that would either be through traditional commission services that we're all very familiar with, it could be through direct payments, or it could be through individual service funds. So in terms of accessing those services, we would go through our brokerage service to access support from our traditional commission services through our domiciliary care framework and our residential care frameworks. And equally, we can go through brokerage for our individual service fund providers, and Siobhan will talk a little bit more about that in a moment. If we're giving somebody a direct payment, then they can actually contract directly with whoever their support provider that they choose, and they're free to do that. In addition, and I think we talked last time about how we've been doing some work with Community Action Network to look at doing some trusted review work with people who are accessing our day services currently, and looking at alternatives that might offer more sort of person-centered and sort of more meaningful activities for them to do during the day. And where, again, you'll hear shortly about, in a bit more detail, about the work we're doing with a social enterprise called Community Catalysts to develop a broader marketplace of support through community micro-enterprises. Now, when somebody receives their personal budget, either as an ISF or as a direct payment, they can use that money to purchase that support directly from a community micro enterprise or from any other provider that is going to meet their needs. The way that money is managed is to make sure it's secure, is done through what we call a virtual wallet, which again Siobhan will explain a little bit more about in a second. And I guess the other point just to finally make is that the personal budget options are available either as a one or any combination of those three sort of routes. And then lastly, in order to make sure that everything continues to work properly, we regularly check in or catch up with the individual in terms of reviewing the arrangements, making sure that they're working and that everything's satisfactory. So I'm just going to pass over to Siobhan now. Let me know when you want me to progress the slides.
Okay. So individual service funds are a new mechanism that we're using to support people to buy their services. So we currently have direct payments where a person takes full control of the monies that we allocate to them for their support, or they can have a commission service where we buy the service on their behalf. There are people that are saying they do want to have choice and control, they do want to be able to manage their own budget, but they feel that the processes around direct payments are too burdensome and they'd like help with that. So the individual service fund is around working with a provider that perhaps provides support to them already, and they will take on the financial management of that budget, and they will work hand in hand with that person to provide a support plan and identify how they want to spend that money and continue to manage it. So that's very important in terms of our objectives around choice and control and enabling people to have as much control over their support and their care as they want to have. So it's very flexible. It obviously does meet individual needs. It allows people to be very flexible in how they spend their money. So just because they spend the money in one way one week in terms of meeting their outcomes, they may choose to do that differently the next week in terms of how they meet that same outcome, but they don't have to get tied into a single service or a single way of doing things. If it's about your fitness and you want to do things differently, you might want to go swimming one week, but you might want to go to Keep Fit the next. You don't have to be tied into that, and that's what makes these personalised plans within individual service funds really flexible for people. So it's just creating more options as well as direct payments and commission services. Could you move on to the next slide? Thank you. Now, we obviously need to have some sort of mechanism and accountability to allow the money to pass between the local authority and the providers who are going to be supporting that person, and also that person has oversight and control over their budget. So we're not taking that away from people by having the provider manage that. So we have something called a virtual wallet, which is a system that allows both the local authority, the provider and the person to have sight of how that money is being spent and managed. So it gives us that accountability and that confidence that it's being managed appropriately. It allows the person still to have control over that spend, and obviously the provider managing that in the middle. Can we move on to the next slide? Thank you. So if we move on to community micro enterprises, which very much fit with direct payments and individual service funds, which are really there to allow people to look at their communities and say, how can I make my account? What's in my community that can support me? And we've been working quite hard to find ways to localise the support and make sure it fits the people in that local community. So within our day opportunities, we have something called trusted reviewers. They are working very hard to build intelligence for us by engaging with our young people who are preparing for adulthood, for what we're calling younger older people who are thinking about what they might need in the future and how, again, fitting with the prevention strategy, how they can support themselves to stay active and well, and reducing things like social isolation. So they're providing that intelligence by having those conversations with people in their local communities or within those groups. They're feeding that through to the community micro enterprise, who then goes out and tries to source that type of service. And that can be different ways of sourcing that. It might be a small business, locally run business. It might be an individual that wants to provide support or companionship. So it's about providing flexible options within each local community, reducing down the need to travel. Because quite often when we have commission services, there might be just one service. They might have to travel across the conurbation to reach that service. So again, it's about kind of being in your community, reducing isolation, connecting you to your community and making sure that you get the support
you need to meet the outcomes that have been set for you. Could you move to the next one? Thank you. So as we've said, they're very small scale. And they tend to be sort of, most of them we've got at the moment, or all the ones we've got at the moment, are single people services, but they can be slightly bigger. We do have some local services where you might have more than one person working in them. They are locally focused, so we're making sure that we're looking at the communities and what those needs are in those individual communities, that they're diverse in what they're doing. So it is again about what do people want, how can we support them, whether it be anything from companionship to shopping to taking somebody off to exercise, whatever it is that actually that the community identify they need, and bringing that to a local level. And obviously it is very personalised and bespoke. Next one. Lovely, thank you. So as we say, it is around a person deciding how they want their support to be purchased. It is again about that increase of choice, making sure that we have as many different options as possible. And if we don't have them, it's continuing that conversation with the local community. So this isn't just a one-off project. This will continue to run, and we will continue to develop community micro-enterprises as our communities develop, and they might change. So it's important that we continue to develop those services. We've had some really good outcomes in terms of social connections. I mean, we had one example of an elderly lady who was isolated in her home. Her son was struggling because he was working full time to actually get her out. And we were able through that work to join her into dancing groups, because that was something she was very interested in, and other groups that she could actually then engage with and reduce her social isolation and her independence. And I think what's really important is we are not purchasing services from big organisations that might be across the country, but actually this is about local people who have local skills that want to use those in their local community. So it's very interesting that we've just had to talk about getting people back into employment. Actually, this is how we want to support that, and we are engaged obviously with that plan in terms of getting more people back into employment. Perhaps you've been a carer in the past and you want to not work for domiciliary care anymore, or another provider, you want to come out and do that work yourself, or you might be a gym instructor and you decide you want to work with them. And then just to explain where we've got to in terms of our performance. So we currently actually have, as of today, 4 CMEs who are accredited and operational. So that's just a quick update. We have 10 community micro enterprises who are currently in development, and we've got 12 others that are interested. Our target for this year is actually 15. So we are looking to exceed that quite significantly, bearing in mind we're only 6 months in. And then we have just some examples of the 3 CMEs that were noted there, which are quite varied in the sense we've got sort of active opportunities. We've got a club in Folkestone where somebody wants to do fun activities, engaging activities, and we have companion support. So that could be with somebody in their own home, perhaps, you know, in the winter playing puzzles with them, or it could be taking them out to different activities. I think that's mine.
Thank you. I'm going to give you an update on the short-term support project. So I think we've already heard from Tricuro this earlier this evening. So they reflected in their slides about the significant operational changes that had taken place up until December, and that went live in the early part of 2025. Those operational changes were about structuring to improve efficiency. Again, I won't go over some information that was provided in those earlier slides. So when we started this journey, the immediate priority for this programme was to stabilise and maintain the reablement service hours. And I think there is a graph on the left, on the right of the slide, that will show you some of the increase in those specific hours. I think it was mentioned earlier that what you would like to see is some of the detail. So the team worked closely with Tricuro, that's the Adult Social Care Commissioning team, and with Tricuro, the reablement services. They looked at the joint reviews of pathways and processes. The reablement services currently support hospital discharge as part of the discharge to assess pathway from the acute hospital, University Hospitals Dorset. So there was a lot of work done to maximise the service outcomes and also increase the hours delivered. We've measured this from April. You can see in April they were delivering about 500 hours. Slight blip in August. What I can tell you about that blip in August, that was about the resilience of the service to continue to deliver those hours. What I've asked the team to work with, and we are working with them on, is that resilience around school holidays, recognising the workforce that we've got, what we can do to ensure business continuity during those specific times. And that will be coming across at Easter, when any month that's got Easter in, Christmas, when there's holiday periods. So Tricura are now a trusted provider, and you're going to hear this word trusted provider, trusted reviewer, trusted assessor. They're bandied around quite a lot. For this, a trusted provider is a BCP Council commissioned services that can do work on the behalf of the local authority. So this is very much developmental change. To do that, we've had to support some of the digital innovation that was needed, and that was launched on the 11th of August. This is about improving and enhancing communication, capturing more detailed information. If I say to you before, it was a bit like capturing information on paper, not always accurate. It was almost, and then putting that into Mosaic. So reduce the time taken for requests to reach brokerage services, a more effective utilisation and efficiency of available reopenment hours. It's about getting those hours reused to get to the people that actually need them. Also, a reopenment app which has been supplied by the Future Care Transformation Programme, that of course Betty is part of the SRO for home-based intermediate care, and I'm the work stream for bed-based intermediate care as part of the Future Care Transformation Programme. So this app is something that's gone, which is new, and it's also going live in Dorset as well as part of their services. But this is about real-time tracking in progress, so you can see where people are, so even families, etc., map their journey and look at their out-time goals. And over the next 6 to 12 months, there will be a trust assessor. Really pleased to tell you that I think the last time we came to you, we were talking about the investment into a community reopenment pilot. That went live on the 15th of September. So the community reopenment pilot, we know that with Tricura focused, their reopenment services are focused on what we call the back door of the hospital. This is to stop people getting to the front door of the hospital. We recognise that the changes that Tricura are going through at the moment, we had to do a pilot to see, what we could get from a community reopenment pilot based at the front door, linking in with the hub, the new approach to the hub as an option for people that would need long-term care if there wasn't this pilot. So really pleased to tell you that Altogether Care are going to be the provider of that service. The expression of interest was done. We had a really good interest in it. They've gone live on the 15th of September, and we've had our first reopenment package of care delivered by them already. So they're quite an innovative provider. So they've been delivering reopenment services in other areas. So Altogether Care will be providing 100 hours from week 1 to week 4, mobilising up to 125 hours from week 5 to 8, and from week 9 to 52 there'll be 180 hours delivered each week. I'm not going to go through the slides. I think the slides, as I've said, the community reopenment. But first of all, want to tell you about Hazel's reopenment journey, because I sometimes think that we get lost, don't we, in data, and sometimes it's for me, this is bringing it to life. So this is, of course, the name's been changed, and that's the picture of the individual. But after hospital discharge, Hazel was unable to safely cross her home thresholds, and she was feeling very anxious, a loss of independence. And I know people might say, well, this is quite normal after a time in hospital. But what mattered most to her, she wasn't being able to do. And that was to go out to her garden, to go to and join her church. So the therapist and the therapy assistants working with her regained independence indoors and outdoors. Increased confidence and reduced anxiety. We've already talked about prevention, about isolation anxiety. We've talked about falls prevention. And she's now actually going back able to go shopping on her own with her family. She's attending church again and going out with her family and returning to gardening. That's the difference a good reopenment service can make. And that's about keeping somebody independent in their own home. Too many people go into hospital and don't come out to their own bed in their own home. We can't carry on like that, and this is why some of these services are there for us. And it's about reconnection. Thank you.
Thank you for everyone for that helpful presentation. Just before I open it up, could I just have excuse me? Could I just ask a quick point of clarification? So, in relation to the community catalysts work, you mentioned within that there was this accreditation process. I'm not going to quiz you too much about what that looks like, but I was just wondering whether there was a similar process in relation to those organisations, people, whoever they are, who are controlling individual service funds, and what, I guess, putting it rather crudely, what checks and balances there are around that.
Yes, thank you, Chair. That's a really important point. So we have something called a framework of supported housing, care and support providers that we commission, put out to tender, and that's evaluated. And the individual service funds are going to be part of that tender to make sure that we evaluate them. They'll go onto the framework as a care and support provider, but then they will go to a second accreditation after that to become an individual service fund provider, and they will fit in with our normal contract management in terms of that framework to ensure that they continue to be suitable. They also get picked up through both CQC, if they're a registered provider. If they're not a registered provider, they get picked up by a service improvement team to have regular inspections as well. And that's done on a risk matrix. So there's quite a robust contract management process as well as quite a robust tender to ensure that they're suitable before they're allowed to pick that up.
And without pressing you too much, is there an exit from that if that provider is deemed to be unsuitable?
Yeah, no, absolutely. If they're not suitable, then we would look to decommission them and move that package across to somebody else that was considered appropriate to pick that support up in the longer term.
Okay, thank you. Any other questions? Councillor Richardson.
Yes, I just wanted to mention my usual point that I mention every time. If there was a provision of suitable housing, you know, such as the housing associations provide, that would eliminate a lot of this problem. But I know that's not going to happen, but I just want to say that.
Siobhan.
Just to add to that, the framework that I've just spoken about, we are actually including supported living and supporting people's homes. So we will be working with our housing colleagues who have developed a specialist housing strategy with ourselves to identify appropriate housing for people that are vulnerable around learning disabilities, mental health, etc. And we will be providing care and support attached to that accommodation to try and increase the capacity in the local area for people with the right level of support and the right type of tenancy and type of accommodation for them.
Thank you,
Councillor. Because it's not really right that you have to have the money to buy a nice Churchill apartment and if you don't have the money, you just have to live on your own somewhere.
Councillor Allen.
I think I had sort of similar slight concerns as you did, Chair, about. So I really do believe that people know what they need. They know, and having these conversations that you're having about finding out what somebody needs and listening to them rather than just sort of straight away putting them in a box and sticking them over there and going, right, well, you need to go here because that fits in with the way that we provide services. So I absolutely think that people know what they need. And I suppose my only concern is how do you help that person to really make those good choices, and how do you safeguard them that what they are spending their money on is actually delivering what they need and that there isn't any exploitation of that person. I know that sounds a little bit negative because I'm not negative. I think what you're trying to do is amazing, and I think it's totally the way forward, prevention, etc., and about individuals. But yeah, how do you help that person to make those good choices, and how do you know that what they then choose to spend the money on, if you like, is actually giving them outcomes in their own key performance indicators, if you like? Thank you.
Betty.
I think there's a couple of things, and I know Sina's gonna, if it's okay, Chair, come back on that point a little bit more, just around extra care housing that can kind of really wrap around and give a little bit more on that point. I think it's important to remember that people have to have eligible needs. So there has to be a mechanism where we have determined with that individual that they have an eligible need. What Siobhan has talked about is different mechanisms through a range of choice that people are able to then take that amount of money to meet their eligible needs. And there are measures in place around that. There are reviews, there's mechanisms where there'll be checks on the provider if somebody's having a direct payment, for instance. There's criteria that needs to be followed. There's bank accounts in particular way. The personal assistance or the provider who's providing that. You know, there's regular updates and regular mechanisms. These will not be any different in the sense that they still have to have eligible needs. There still has to be that review and that monitoring and that mechanism, and needs will change and fluctuate depending on it. I think sometimes it's easy to forget, but within all of this, there has been a determinant, it has been determined that they fall within the remit. So all of those measures that we have around governance and being clear that that the people that are coming in to do this are regulated and or having the checks. We have a responsibility and a duty to do that as part of the overall determination of somebody's needs. So it's just a different mechanism, but all those checks still apply. Is that okay?
Thank you. Councillor Carr-Brown.
Thank you. So first of all, I just want to say how much I love that conversion rate, and I think it's really outstanding. So that's really brilliant. And while we're doing all this sort of new stuff and giving everybody all that choice, I just wondered if there were any sort of like bottlenecks or capacity issues within the market, particularly at perhaps the, assurance of quality. I know that we'll have a quality assurance framework around that, and we've got the CQC and all of that, but it's just like, is everybody able to find what they want at the right time, in the right place, in the right way, within our towns?
I think that's the important piece of work we're doing with the trusted reviewers, is that we are really trying to make sure that we're looking at those different communities or looking at those different groups and asking them the question, are there gaps? I think it's also important that we use those funds to get people just to access what's already in their community. So we're really lucky that we do have very active communities. They do provide lots of different sort of exercise classes or walking groups or nature groups, whatever they might be. So it's not necessarily about us developing social care type services. Sometimes if the outcome is around health and well-being, it might be about how we support them to be engaged in the community, whether that's by giving them a PA to help them to get out, or travel training, etc. So but it is really, really important that we do that work to kind of ask people what's missing, and then that's where we need to use things like the community micro enterprises to develop those services. Or if we need to commission wider, then we will do that. But absolutely, we've got to keep that change and that move in terms of different types of services.
Okay, thank you, everyone. So if everybody's content with that, the recommendation is that the committee notes the current work in progress with adult social care Fulfil Lives programme, and specifically the updates for the self-directed support and short-term support projects. So is everybody content with that? Didn't really have to read all that out, really, did that? But thank you very much. Thank you, Sean. Thank you, everyone, for that. I'm going to move quickly on to the work plan. Just to say that one of the things that you may have seen that was originally on the agenda was around the adult social care budget. What I decided to do, I guess, which hopefully you will be happy with, is to say that we're going to do that completely separately, as a completely separate briefing, and we'll try and fix that date as soon as we possibly can. The fallback is that we have a date set for November, but we've been talking amongst ourselves to see if we can get it slightly earlier than that if we can. But that's the plan, that we'll have a dedicated separate briefing to look at the adult social care budget and what what that looks like for the next year. And then just very quickly, just to remind colleagues what it is that we are due to talk about in December. So we are due to talk about integrated neighbourhood teams, which feels as though it's been a long time coming. And end of life services, which again is something that we asked to be looked at a little while ago, and that's due to come in December. And then we also will get in December a couple of formal things that we need to do. One is the Safeguarding Adults Annual Report and the Adult Social Care Complaints and Quality Assurance Annual Report. A couple of formal things that we need to clear up at the December meeting. So are there any other points anybody wants to ask on the work programme? If not, sorry, you've got the graveyard slot, Councillor Brown. Handing over to you now.
That's all right, I'll try and wake everybody up in the graveyard slot. Do you know, it's only a couple of months since the last meeting and we've had the summer break, so I thought there's not a lot to update on. And then I looked back through my diary and I look what's been going on. There's quite a lot actually, but I'll keep it fairly brief because you're obviously aware of the ongoing stuff like the Fulfilled Lives Transformation Programme that we've had presented, and actually I really like that presentation. I love the animation. That was and just almost this animated slide. That's the sort of thing I think all members need to see and be aware of, just to actually understand the process of the 3 conversations model and then where things go. Because I think, you know, we've had presentations to all members just to try and explain adult social care, and you can read reports and that, but that one animated slide to me just cut through, and I think for member understanding, I'm probably going to, if I get a copy of it, share it with my cabinet colleagues for a start, so they get an understanding. So yeah, you're aware of obviously at Cabinet and Council that the further 1.1 million funding was approved, and you've seen the sort of progress that's been made on that. There's been a lot happening over the summer in terms of the Integrated Care Board and changes to that, and clustering, so Dorset ICB then clustering with some of our neighbours, and changes to the sort of senior management there. So that's all still sort of moving on. And we had an Integrated Care Partnership meeting in July, which I think will be the last one. So it's, there's conversations going on about, well, with the changes to ICBs and clustering with neighbours and Integrated Care Partnership not sort of meeting, then what responsibilities will the Health and Wellbeing Board have to sort of make sure that it sort of fills the void? So yeah, those sorts of changes directed by central government are sort of working their way through. Tricura, I think I'm really pleased to sort of presented, and since the last meeting we've had a board meeting and a shareholder governance meeting with Tricura, and I think we're getting a good working relationship with them really. You know, because they've had a challenging time over the last year or two. CQC preparedness, I'm sure, you know, if anybody's interested, Betty can update people, but you know, that's all in hand, and I know sort of data's been sent off to CQC, and it's the week commencing the 1st of December they're going to be on site to actually come and do their, not inspection, their assurance visit, isn't it? It's a CQC insurance visit, it's an inspection, but so yeah, they'll be coming. Had a really interesting meeting, the Senior Leadership Network meeting at the Pavilion towards the end of July, where dozens and dozens of our senior management and directors and get together, and actually it was all focused on wellbeing, which is why I was invited along, and it had a really interesting case study from somebody sort of almost a cradle to grave, of how their life had progressed, and they've needed, effectively tried to get every adult social care and housing and wellbeing service through their lives, so they had drug addiction problems and everything. I felt really sorry for the guy afterwards. I don't, because you know, his life was really difficult, but actually, you know, I did have a comment from a highways officer saying, "God, how much did that person's life cost us?" Yeah, it's an illustration of a person that to illustrate the services that are offered throughout people's lives, really. But that was a really interesting event. actually had, it's not within adult social care, but I made a visit to the Lifeline, BCP Lifeline service. It's now based at the Kinston Hub. Although I think it comes under commercial operations, but it was really interesting to go and see them. So obviously this is where people have their pendant alarms and that sort of thing. And it's a call centre there, calls coming in all the time, and 24/7 there's people sat there in their call centre taking the calls and directing the team. And they've moved from their office at Creekmore up to the Kinston Hub. It's better offices, and actually the hope is that it's really going to improve that Lifeline service, because as well as supplying the kit and the technology and the equipment for people, they do their mobile response service. So they have a group of cars and guys in the cars who will respond to the calls and actually go out and make sure they can pick people up off the floor or whatever it is that they need. But they've only ever been able to offer that mobile response service in the Poole area and then sort of west of Bournemouth. But now based at Kinston, the hope is that they can now start to extend that mobile response service. I mean, they won't leave people on the floor. They'll call emergency services or ambulance or whoever is needed to respond to it, but they can't do it themselves. But now they're hoping to be able to respond in sort of east of Bournemouth and over to Christchurch ultimately, hopefully as well, so we can get a much more cross-conurbation service. So that was really interesting to go and see them, and I'd recommend if anybody is interested in what they do, I'm sure they'd be happy to accommodate and show you their operation there. And there's thousands of people using that service across BCP, and it's all it's hidden away a little bit. Other than that, say on the commissioning side, the big thing for the summer has been about NRS healthcare. So you're probably aware that NRS healthcare nationally went into liquidation. Was it the end of July, wasn't it? I think. Yeah. So and frankly, there hasn't been. I haven't had my inbox inundated. I haven't had like the press on the phone. There was a bit of coverage in the local press and nationally on the BBC and stuff about the fact that NRS Healthcare have gone into liquidation. But we've managed to move the service over to Mediquip, and it's been a bit, I know through August was a bit sort of dealing with critical and emergency calls really and responding to that. But the fact that we haven't been inundated with lots of sort of calls and crisis situations, I suspect other local authorities have possibly struggled a bit more because they didn't have somebody in the wings that they could actually sort of work with to take it on. I think that's a real success story. It's been kept a little bit quiet, but the fact that we've actually had a major provider failure within adult social care on a massive multi-million-pound contract and managed to cope with that and move over to a new provider, and to all intents and purposes, hasn't really been sort of made the headlines. That to be able to cope with that kind of major provider failure is a real success story, I think. Other than that, public health, I need to mention public health a bit as well. So your team's getting up to full complement now, I think, isn't it? Because we've had successful recruitment of public health consultants, and there's another 2.6 public health consultants as a part of our successful recruitment there. So that'll be really good, because that's just the infill and the expertise strength that we need to sort of make sure that now having sort of public health in-house within BCP can really sort of start to move forward. So so that's a good news. I thought it was a quiet summer, but loads has been happening. And then on top of that, the corporate director for wellbeing recruitment as well, which has gone through, which members will be aware of from full council. So Laura Ambler, I'm not sure exactly what date she'll be joining us, but that will fill that gap, and I think she'll be a real asset to BCP and really sort of strengthen our whole team to be able to. There's so many strategic projects going on, and to be able to oversee that sort of delivery and actually direct our future sort of strategic moves and work with the whole corporate director and sort of senior leadership team. So yeah, I'm really pleased that that's all going on. And to be honest, with all of that going on, I think when CQC coming on, I don't think they can fail to be impressed, because I'm impressed with everything that's going on and all the stuff we've had presented tonight. So I should be telling CQC that when they come in December. So.
Thank you. Yeah, I'm sure we're in a position to say to CQC, come on, ready or not. But thank you, David, for raising that thing about the major failure of a provided. That's a huge operation that went bust, and I think it was managed very professionally and successfully. So thank you to the team for all of the work that you did on that. Because I'd like to say nobody noticed, but not quite true. But it didn't cause too many ripples, did it? I think that's really a testament to the work that was done. So thank you very much, and thank you everybody for your time this evening. And we'll see you again at some point in the future. Thank you.